Good afternoon, and welcome to the 2025 SHEP Internship Academy keynote session. My name is Jen Handy, and I'm the Interim Executive Director here at SHEP, and I will be your host today. In a moment, you will hear from our speaker, Greg Duncan. At the end of his presentation, there will be time for your questions. I encourage you to jot down questions throughout the talk or just different ideas you have. During the Q&A, you will be able to put your questions directly in the chat, or you'll be able to unmute, like raise your hand, unmute, and ask them directly. I will say that earlier this week, he mentioned that he is excited to hear pushback and your hard questions. So he invited the hard questions, and I encourage you to bring those with you. Hopefully he does not regret that. So today, Greg Duncan is a distinguished professor in the School of Education at the University of California, Irvine. He spent the first 25 years of his career at the University of Michigan working on and ultimately directing the Panel Study of Income Dynamics, or the PSID, data collection project. His recent work has focused on estimating the role of school entry skills and behaviors on later school achievement and attainment, and the effects of increasing income and inequality on schools and children's life chances. He is part of a team conducting the Baby's First Years Project, a random assignment trial assessing impacts of income supplements on the cognitive and socio-emotional development of infants born to mothers in 4 diverse U.S. communities. In case that project sounds familiar to you, if some of you have been with the SHEP for a while, Dr. Lisa Janetian, another PI on that work, joined us in 2022 to talk specifically about the Baby's First Year study. Duncan was elected to the National Academy of Sciences in 2010 and has recently chaired 2 NAS consensus panels on child poverty. The second, focused on alleviating intergenerational poverty, will be the subject of today's talk. We are incredibly lucky to have him with us here today, so join me in welcoming Greg Duncan.
Thanks, Jen. It's great to be here. We were saying, I did a talk in person. It was probably 10 years ago, right, in Atlanta. So I got to know what the organization was about and how good the things it does are. So I'm very honored to be back and talk about this. I have to warn you, I did make a unscheduled stop at the dentist before appearing before you. So I have half of my face operational, and I think that's all I need. So we'll see. And as Jen said, no, I do. Being an academic is all about welcoming pushback. So think of good questions about anything. So I look forward to that part of the discussion. So I want to talk today about a National Academies report. This second one that Jen talked about, that I chaired the committee and we wrote the report. It came out a couple of years ago. And it's all about evidence on policies and programs that have been proven to reduce intergenerational poverty. And let me start out with, the question is really, what policies and programs can we provide to children or their families now, so that 20 years from now, the children, when they grow up, will not be poor, right? So it's, an absolutely crucial issue. And the kind of good news is that we found quite a few policies that have been proven, and I want to talk about those this morning. But first, a word about the National Academies. It began in 1863, in the middle of the Civil War, around the time that Abraham Lincoln issued the Emancipation Proclamation. Congress, in the middle of wartime, not only set up the nation's system of land-grant colleges, Pennsylvania State University, North Carolina State, with the mission to carry the science that was being learned out to the people. So very farsighted, but they also set up the National Academy of Sciences. It's a chartered organization. It's not a formal government organization, with this general charge to investigate, examine, experiment, and report upon any subject of science. So its first request that was made by Congress was to figure out a way, this was a time when ships were going from being wood to being ironclad. Old Ironsides was a big important ship during the Civil War, and they couldn't get the compasses to work. So the first task that the National Academies had was to figure out how to make compasses work on ironclad ships. But now it takes on studies that are usually requested by Congress, sometimes they're requested by foundations, and the form of these requests lead to a committee that's being set up and then a report that's being written. So that's what this is all about. And in particular, this report on intergenerational poverty came from Congress. It was a request from Congress. And the request was to provide a nonpartisan evidence-based report that identified key drivers of long-term intergenerational poverty, identified evidence-based policies that have the potential to reduce intergenerational poverty, evaluate racial and ethnic disparities and cultural and structural factors that perpetuate, and then identify where we should go with the research on intergenerational poverty. So this report was released in 2023. It's free to read on the National Academies website. I'll give a little information about that toward the end. But I want to concentrate on these evidence-based policies that we came up with. The committees, in this case, consisted of 14 members. Many of them were academics, but there were some community people, some think tank people, chosen to be diverse politically as well as in terms of their subject area expertise. And the idea is to get 14 people to meet over a course of a couple of years, debate, and then write a report that every single member signs off on, right? So it's a consensus report, and it's an interesting task in such a polarized world that we have today. But that's, those are the rules, and committees come to understand the nature of making compromises and figuring out what's really important. So anyway, our report is one of these consensus reports. The topic is intergenerational poverty. So we started out with a definition, which is pretty straightforward. A situation in which children who grow up in families with incomes below the poverty line are themselves poor as adults, right? So we first wanted to start with data, and there is a wonderful source of data based on IRS tax files that covers the entire population. And we defined children who are living in actually low-income situations as children in the bottom 20% of the distribution of income by over their childhoods, right? So take all the kids, look at what sort of family income those kids have every year between birth and age 15, and average that income, and then get a ranking of that income. And what the data I'll talk about are comparing kids who are starting out either in the bottom 20% or the bottom 10%. But one of the things we did defining low income as being in the bottom 20% is just to say, if you've followed those kids in the tax records for 25 years and look to see when they're in their 30s, what sort of family income do they have as adults, right? So the first question is, of all the children in the United States with family incomes that place them in the bottom 20% of the income distribution in childhood, what fraction of them are no longer poor in adulthood, right? How many escape low income status? And when I ask that question of audiences, I won't have a chance to do it in an efficient way with you all. What fraction of people starting out in the bottom 20% are not in the bottom 20%? or let's do it this way. How many are still in the bottom 20% when they're adults, right? And people usually say at least half, maybe 60%. It turns out that figure is only about a third, 34%. So, the kind of good news is there's considerable mobility out of poverty, but it by no means is it complete. And I think a better way to think about this is take this average income over 15 years, rank people according to where they are in the income distribution, and think of the income distribution as a ladder with 100 steps, right? The first step is the bottom 1%, then the bottom 2%, and so forth. So let's start out with kids who have family incomes that place them in the 10th percentile, right? 90% of families of kids have higher incomes during childhood, 10% have lower incomes. They're starting out at the 10th percentile. Where do they end up as adults, right? And again, when I ask audiences, they'll say, oh, maybe the 20th, maybe the 25th. For white children, the average economic status in adulthood is up at the 40th rung, right? So that's considerable intergenerational mobility. For Black children, there's considerably less. It's only about the 30th rung. And if you look at all the groups, you see a lot of differences in where they end up. Asian children starting at the 10th ladder rung, on average end up above the average, the median adult income, about the 52nd rung. Latino kids, and this I think surprised a lot of community members, have as much upward mobility almost.
It was decent, right? That was good. That was good 4 reps.
I'm sorry. Okay. Yeah, well, if it is good if you're interested in mobility across groups, to see the group of kids whose parents identify as Latino do as well as whites. Both Black children and Native American children do worst of all, don't even make it to the 30th rung, right? So the picture is one of striking upward mobility, but that's quite differential across different kind of groups. If you look at it geographically, there's a lot of variation depending on where you spent your childhood, right? So same data. This is looking at kids whose parents, again, are low income. On average, where are they as adults? And the areas that are more red are areas where kids have the least upward mobility. You can see the scale up at the top, 20,000 on average, all the way up to 55,000. As you get into the blue areas, this is more upward mobility. Again, they're starting out low income. They're all starting out low income. I think this was a bit surprising as well. But the point is, there's a lot of geographic variability. If you burrow down into the neighborhood level, this is just the state level or the county level, I guess, you end up with some neighborhoods, even within the red counties, that have a lot of upward mobility, and the highly upward mobile counties have areas where mobility is quite a bit less. So there's a lot of variation at the local level, but in terms of racial differences, in 99% of the neighborhoods, you see that the upward mobility of Black children is less than it is for white children, right? So there are really pervasive differences by ethnicity and race. So what can we do about it? And the item of the statement of tasks that I want to concentrate the most on is this second point of identifying policies and programs for which there is strong evidence that they will reduce multi-generational poverty. So we looked at quite a number of different areas. If you think about the different kind of program areas, it's health, it's education, it's labor market, it's crime. There are just all sorts of areas where there might be policies and programs that kids might benefit from. And we looked at all those. And I just want to highlight 6 of them, or I guess 5 of them. I don't know why I put 6. Education, employment, health, crime, and then I want to talk about racial disparities. So let's dive right into it. Education. What sort of education programs seem to have proven themselves to reduce intergenerational poverty? Just kind of setting the stage, again, there are pervasive racial and ethnic group differences in terms of how kids are doing in school. Asian kids back in 2000 were not doing as well. These are reading proficiency rates for 8th graders. Weren't doing as well as whites, and now they're considerably above whites. But you can see this cluster of Native American, Latino, and Black kids. In this case, the Latino proficiency rates are not close to what the white rates are. So the racial and ethnic differences really depend upon what kind of outcome you're looking at. This is showing considerable progress, at least between 2000 and 2020. The pandemic really undid a lot of this progress. So we're kind of back to the starting point across all groups, with groups that were already low losing the most. But anyway, how do we address these kind of education problems in ways that are going to promote upward mobility? And we identified some K-12 policies that had proven themselves, post-secondary, and then there's some interesting occupational training programs that have proven themselves. So with K-12 schooling, kindergarten through 12th grade, the research is pretty clear that programs like the Title I program that provides extra funding to schools and districts with high rates of child poverty, those work, right? They're consistently showing not enormous gains for students, but higher gains than in schools that didn't get the Title I funding. Another thing that's quite durable in terms of a finding is that matching teachers and students by race, ethnicity has a positive effect on the students that's quite long lasting. So if Black children have a greater number of Black teachers, they do better in terms of achievement, attainment, and the effect lasts for quite a number of years. So efforts to kind of promote diversity in the teacher labor force are effective ways of promoting intergenerational mobility. And then another area that has proven itself is the importance of reducing exclusionary school discipline problems. Kids who end up getting assigned to schools that have very strict discipline rules that lead to expulsion or suspensions, those schools produce kids who aren't achieving as much as schools that don't have such strict exclusionary discipline problems, right? So that's another area where you can have an impact on intergenerational poverty in the kind of K-12 schooling. Post-secondary, Pell Grants have a mixed record in terms of their success, but there are other models for providing financial aid where there are more consistent successes. There are also a number of really interesting programs on supports that campuses can provide, tutoring supports, case management, trying to make sure that students are kind of keeping up in terms of being on track to finish their education on time. Those have proven effective. And then finally, there's a set of, it's not community colleges, but in some cases, there's career and technical education programs in high school, but then there are these interesting sectoral training programs. If it's a local area, let's say where the hospital sector, healthcare sector is huge, there's a need for medical technicians. If you set up a training program with internships, you can have, if you look at the costs and the benefits, those tend to be quite beneficial in terms of providing kids with the skills that they need to get the jobs that pay pretty well, right? So that's another area of success in terms of programs. Income and employment programs, one of the facts that I'm sure you're aware of is how much household income inequality has increased over time. This is just tracking it way back to 1967. Low and middle income groups have gained, but the gains are much higher at the top, right? No big surprise, but this is a way of documenting this. So what can we do? And here the program change that consistently was associated with improved child well-being, higher graduation rates, higher earnings for kids who had been in households where the earned income tax credit was more generous. So the earned income tax credit increasing the generosity either at the federal level or state level, a lot of states have supplements, it looks like a very good policy for promoting intergenerational mobility. Health is a big driver of intergenerational mobility. I think most of you know these facts about how much worse the health is for children in low-income families. It starts before birth and continues into adulthood. Despite the policy changes, I'm thinking of the policy changes that are about to descend upon us. Many low-income families lack continuous health insurance coverage, and that number is going to increase very soon. And then there's another driver, which is exposure to pollution. And a number of studies are showing how damaging that is to kids in ways that are going to affect their economic success as adults. So here, there were a number of health-related programs that have proven themselves. One is family planning. If you look at kids in areas where this program called Title X, it's a big federal family planning program. Kids in counties where those Title X programs were in operation end up doing better than kids in counties where there wasn't that kind of program. And this carries over into Medicaid as well because you can provide family planning services. Health insurance, it seems too obvious to say, but kids do better when their families are insured. And there are a lot of gaps in coverage, and soon to be more. We try to look at policies that related to Native Americans, and the Indian Health Service is the health service that provides health care for a lot of Native Americans, and that seemed to be effective as well. Nutrition, we have SNAP, and having access to SNAP benefits has lifetime benefits for kids' health. And then finally, pollution. And what's the kind of frontier for the next area for reducing pollution is indoor air quality, especially in schools. And there aren't federal programs there, but there's a lot of action at the state and local level. Crime is a big area. in part because low-income kids and kids as opposed to adults are most likely to be victimized by crime. If you look at just the simple annual death rates among children and adolescents, you see that firearms-related deaths are now the most important cause of death, right? That didn't used to be the case. We've made a lot of progress on car safety, at least up until about 10 years ago. Cancers are causing fewer deaths. Drug overdosing is on the rise, but it's nowhere near firearm-related kind of deaths. So what can we do about that? Well, one area is the juvenile justice system. And here studies are showing that incarcerating juveniles, as opposed to some other kind of program for offenders, even for short periods of time, can have long-lasting negative consequences, right? So figuring out alternative to confinement for juvenile offenders is very important. And so it's very obvious. There's been a lot of progress here. The juvenile incarceration has declined substantially. But for reducing victimization and crime more generally, there are a set of programs cleaning up neighborhoods, surprisingly reduces crime. Having more community-based organizations reduces it as well. Somewhat controversially, there's evidence that's pretty strong that increasing policing in high crime neighborhoods reduces crime. Of course, it depends on how effective the community policing strategies are. But there are, again, areas that where research has shown programs that really work. Gun violence, you can go on with what we can do to prevent victimization. And there are just a lot of these studies that show that if you limit child access to guns, promote sentencing add-ons for violence using firearms, and then there are an assortment of other kind of gun safety measures. Local areas have instituted these, and research has kind of looked to see to what extent crime, especially homicides or child accidental deaths, declines as a result. We are politically incapable of making much progress on this agenda, but studies show that if we can, it can have a substantial effect on kids dying from gun violence. And then finally, you can kind of step back and say, what about more human capital strategies? That kind of K-12 school spending we talked about before, it promotes educational attainment, but it also reduces crime, right? So you kind of get this double-barreled effect from that. And there are some interesting other kind of programs. There's one called Becoming a Man in Chicago, which seemed to be quite important in reducing crime. We can talk about that if anyone's interested. Let me just, there's a very long chapter about the development of racial and ethnic, the whole history that you all know, our country has lived through. We try to review that, but then once we get to the policy part, we try to see of these policies, which policies have evidence that they work in particular for Black children or Hispanic children or other subgroups of kids. There's not much research about that, but most of it is for Black children. What what programs work, and 13 of the programs that it's about half of the programs that we identified had research that suggested benefits in particular for Black kids. We talked about increasing K-12 spending. That's particularly true for Black children doing well. Monitoring air quality, that shows up for both Blacks and whites. Reducing juvenile detention incarceration, same thing. And then the earned income tax credit, we were saying in states where there are supplements that are more generous, kids do better in the long run. That's particularly true for Black kids, right? So there are encouraging examples where these kind of racial and ethnic differences that we started out with can be addressed to some extent with kind of programs that we review. So the good news, we reviewed the evidence across seven different areas, and most of them produced examples of policies and programs that kind of passed muster. There was good, strong evidence that they reduced intergenerational poverty. So it's not as though there's just one or two policies in one particular area that are working. There are policies to be found that are effective across quite a number of different domains that affect intergenerational poverty. So let me stop there. As I say, if you just Google reducing intergenerational poverty, NAS, National Academy of Sciences, it'll take you right to the page where you can download this report. Don't be intimidated by its 600-page length. There are also much more accessible summaries, and so you can get an idea of where the action is in terms of these programs and policies. And you can also, if you're interested in the research, all the research is reviewed, so you can kind of dig into any of these particular areas. So with that, let me stop and start in on your questions.
Thank you so much. I put in the chat, I'm sure these y'all are used to hearing this from me. I've given you all links to the full report, but the issue briefs, which are a little easier to digest. There's also an interactive report. You can kind of figure out that. There's also a good podcast episode, I think, with one of the co-authors, kind of all listed there. I'm going to start with a few questions to give you time. You can put things in the chat, or in a second, you can raise your hand, or like virtually Zoom, raise your hand, and we'll dig in. My first question is, when we think about policy and intervention for issues like housing, crime, or jobs, we tend to imagine urban settings. Many of our schools are located in rural communities. Many of our interns will be working in rural areas for the summer. How applicable are your findings to kind of rural settings?
That's a great question. And if you're at all interested in a rural research, you know that there's not much of it.
Mm-hmm.
And indeed, that's pretty much the case with most of the policy research that we do review. So you'd really like to have evidence from both urban areas as well as non-metro areas, and that's often not there. And you know, certainly the case that the problems, the kind of solutions to problems take on a different structure oftentimes because of the low population density, of the distance that people have to travel to get services. So you know, somehow the Indian Health Service has solved or at least helped to address that problem. But you know, we did look to see if we could we did a kind of racial ethnic cut to try to see if we could do a rural cut, and it's a very slim pickings kind of situation.
Yeah.
So if people are aspiring to do policy research, I would urge them to consider rural areas as being a setting for them.
Yeah. I'm going to go kind of one with the hand raised, and then I'll go to the chat. So, Megan, do you want to unmute and ask your question?
Yeah, sure. I was just curious about from your personal experience or your opinions about the efficacy of universal basic income or UBI-like programs that have been implemented. Like, how do you see those? If we should be trying to use those more or if they're not so practical.
Yeah. Do you have 2 hours? I'm a collaborator with Lisa Janetian on this Baby's First Years project, which is kind of a universal basic income directed at families with kids. So we've been going on for 6 years now. We recruit low-income moms just given birth, and they either are getting $4,000 a year from us or $240 a year from us. And then we're following through to try to see if the kids are helped. The UBI programs tend to be set up for adults and don't tend to pay much attention to whether there are kids in the household or not. And the kind of outcomes, if you look at the research from the UBI pilot studies, is focused on adult employment, adult education, with the income payments kind of increase that, adult health, mental health in particular. My reading is that there are some scattered impacts from these pilots that have been done on adults. It's not always positive. What's surprising for Baby's First Years, as well as a number of these pilots, is that you don't get the kind of improvement in mental health that you would expect. Reductions in depression, reductions in anxiety, reductions in self-reported stress. It's a real puzzle. One of the fears is that when you give people money, moms will work less, and stay home and take care of their kids, God forbid. And there's not much reduction in labor force participation among the moms. In Baby's First Years, we did ask about drug use, alcohol expenditures, tobacco expenditures, opioid use, because there's a stereotype that if you give people money, that's what they're going to spend it on. And there was no evidence that that was the case. But in terms of, we're just coming out with a 4-year paper, 4-year-olds from Baby's First Years. We brought kids into the lab. We did brain scans. We did achievement tests. We did assessments of executive function. And to our disappointment, it's very difficult to find any differences between the group that gets the kids whose moms are getting the higher payments relative to the lower payments. It's $333 a month versus $20 a month, right? That's the kind of contrast, getting it loaded on their debit card every month. And we had expected to see that kids would be doing better. And one of the reasons, I think, they are spending more money on books and toys and things like that for their kids. We have a qualitative study and are learning that the moms are doing things like buying a winter coat for their kids. They didn't have a really good winter coat before. They're taking them out to eat, once a week or once every other week. They're doing the things that are a part of normal family life, right? So it kind of provides an opportunity for families to be real families. I mean, as they think about it, they are able to do what other families can do. And whether that filters through to benefit the kids is a real question. Winter coats childhood's happier, but are the kids going to be more ready for school when they turn 5? So there's kind of this chain of logic that has to kick in from the income to things we care most about, which is how well the kids are doing, and something along that link, the chain of impacts isn't strong enough to convey big differences and produce big differences in how kids are doing.
We had a question kind of about the stats. So you defined poverty as being the bottom 20% of people. Why did you choose that specific metric as opposed to other options for defining poverty?
Yeah, we actually tried 10 different ones. One of the things you fear is that you make a decision that seems to make sense, but some other alternative decision that's a little bit more generous or a little bit less generous would produce a different picture. So that was just for illustrative purposes. I think people can think about 20% in a pretty clear way. But there's an official poverty measure. There are a couple of them actually that the U.S. government maintains, and we provided data using those as well. It tends to grab less than 20% of the kids, especially recently. But regardless of what definition you take, you get the same picture of upward mobility, where it's a surprising amount. It's not complete upward mobility, and it's very differential across groups. So those kind of results are consistent across all of them.
Perfect. Jeffrey.
Yeah, so talking a lot about the map you showed earlier of like all the states, like ranging from like 20,000 to like 55,000, like the differential between
Right.
like childhood and adulthood. How much of like the differences in international equality is driven by state policy, like Medicaid expansion, gun control, like education funding, and how much of that is due to like the history of like slavery, other policies and stuff like that?
A gigantic question, and it's very hard to determine what the actual effects of structural factors like structural racism, slavery, and so forth have. The report reviews some of that, and it's pretty clear. There's a study of Native Americans who are on reservations that either were subject to a kind of breakup and where non-Native American whites were taking over substantial hunks of the reservations. You can compare the kids growing up in families where that didn't happen versus did, and you can see long-term effects. Redlining, there's a history of redlining where lenders draw neighborhood boundaries where they're not going to lend to people inside those neighborhood boundaries. You can go back to the 1930s and get maps that have the redlining, and you can show 50 years later, there are effects of that redlining. What's much more difficult is to take the kind of post-civil rights era where legally the whole structure changed from what it had been. There are studies like audit studies where you send in people to try to get a loan, apply for jobs, resume studies where everything is the same except for race or some other feature, and that shows differential treatment usually. But to get a kind of comprehensive view of the effect of structure it's very hard to do. I would encourage you the author of a lot of those neighborhood studies is Raj Chetty, Chetty. He was on the committee, and he's done a lot of work trying to see what it is about the neighborhoods that are associated with better intergenerational ability outcomes. So I would some of that's reviewed in the in chapter 2 of the report, but the original research is also really interesting to read.
For those, if anybody else is watching the chat with all of the questions, which we probably will not get to all of them, but I'm going to do my best. I put in a link for Opportunity Insights, which is the group with Raj Chetty, and then Matt put in specifically their Opportunity Atlas. It's just rich resources. You could get lost in there for weeks. So, yeah, especially when you're looking at the charts, and once you see those graphs and the different, I feel like I can pick them out of a New York Times article now. I'm like, that is an Opportunity Insights map. I can see it. They have a specific look. And
they also have as much of the data as they can share. So if you really want to know for particular subgroups, what the intergenerational rates of mobility are, they have spreadsheets that are wonderful in terms of the information they provide. So you can do a lot of research just from an Excel spreadsheet. So I would encourage you to look at that Opportunity Insights link.
Yeah. I'm just going to grab one from over here. So you specifically mentioned trying to get rid of exclusionary discipline in schools. What are examples of non-exclusionary discipline? Like, how do you still have discipline that is non-exclusionary?
Yeah, well, you can still, if people need to be separated from their class, if they're too disruptive, right, you can still do that. But you can do it in terms of in-school detention, right, rather than sending people home. And, there are various kind of approaches to the in-school treatment of problematic cases. And that, on balance, they seem to produce good outcomes. And, the research looks at cities where there are lotteries for high schools. So some kids are winning the lottery, some kids are losing the lottery. And to schools, some of which have exclusionary discipline policies and some of them don't. So, it's random assignment because it's a lottery, and the kids who kind of lose a lottery end up going to a school with a lot of exclusionary policies, end up doing worse than the kids who don't. So different schools have different approaches, but somehow, on balance, the schools that have a non-exclusionary set of policies in place have kids who are doing better in terms of their complete schooling.
Perfect. Pato, I'm getting there.
Yeah, Patokame.
Patokame, there we go. Thank you.
So my question was kind of your thoughts on the cycle of dependency of different institutions and programs. I know you mentioned SNAP, and there's things like WIC, housing assurance or assistance, things like that. But with those programs, it requires you to make a specific amount of money, and if you make more than that, then you're kind of cut off or you're lowered, and it makes families who are in poverty kind of stay in poverty, so they're able to keep getting those assistance. And I think there's also this cycle of violence where the children who are within families that are forced to, again, stay in these programs, when they go to college, things like financial aid that are very dependent on your family's financial circumstances. Again, you have to either completely take loans or work study, things like that, that kind of prohibit you from fully engaging in academic work, things like tutoring, which were also mentioned to help students. Maybe they might not be able to go to these tutoring sessions, things like that. But how do you improve these programs that are implemented and kind of exist to help families if it kind of forces families to rely on these programs solely?
Yeah, well, that's a packed question, a lot of parts to it. I think in general, the research suggests that the kind of trapping of people in low income status, some of that exists, but the very data that I presented at the beginning of the talk suggests that on balance, kids who are growing up at the 10th percentile, the 10th ladder rung, a lot of them do very well, right? Not everyone, but a lot of them do pretty well. So some, families are very different one from another. I don't think the kind of not being able to take advantage of some of the programs that I talked about, I don't think that there's as much kind of exclusion from being able to do that kind of thing as you might think. So, the tutoring programs in college, those are directed at students who are struggling, and without regard to income for the most part, right? So I think a lot of programs, once kids get into school, once kids get into college, once kids get into community college, are not tied to the kind of program histories that their families might have had. So I think it's more optimistic than you might think. But it's just half full, half empty. You have a lot of upward mobility, but it's not complete upward mobility, right? So the question is how to move that balance so that you have relatively more upward mobility.
Thanks. I also want to point out we have a lot of questions, but we also have a lot of wonderful faculty and staff who have dug into this report with me and others. And so we will also try and find ways to continue these discussions as a group. I know there are different parts of the issue briefs that kind of dig into some of the questions you have. So this is not the only time that we as a group will be able to talk through some of these ideas. I wanted to get to a question on a topic we didn't touch on yet. I know the paper talks a little bit more about housing, but we didn't dig into that as much today. The question is, how do you feel about housing first policies? So for those who don't know, those are policies where, housing is the first step. You don't have to kind of get the job to get the house or kind of prove something else. Do you feel like it's helpful, or do you feel like there are more effective policies for housing?
Yeah. With the report, we had an evidence standard that was pretty strict, right? It had to be a strong research design, and it had to have followed kids long enough to know whether they were, getting more schooling, earning more in adulthood. So it's important to point out there are probably a lot of programs that are effective, and they just haven't had the kind of evaluation that would enable them to make our list. On the other hand, there are a lot of programs that look great, but when you actually do a good evaluation of those programs, they end up costing a lot more than the benefits that they produce. So, the last item in the statement of task was to talk about research needs. And we just need to know a lot more about program evaluation. But on balance, all my years of looking at program evaluations, there are a lot of disappointments where things that look like they're working, when you really put them to test, don't. But don't be so discouraged because there are, as our report shows, examples of a lot of programs that do pass muster.
Tell me if I'm wrong about remembering. This is why you don't see anything about the child tax credit in there. It's just too new. So you talk about the EITC, but the report kind of needs enough longitudinal evidence. So I feel like we often hear about the child tax credit. It's not excluded from the report because it's not effective. It's excluded because there is just not enough long-term information about its effectiveness. Is that?
That's correct. There is for the earned income tax credit.
Right.
I mean, there is the baby's first year study, which is
right.
very similar to the child tax credit. But you're right. the kind of big increase in generosity that occurred in 2021, that's not long enough ago to do any sort of evaluation on how the kids are doing.
Perfect. So we are almost out of time. I wanted to end, there are a couple different questions in here about kind of looking forward. And so two parts questions. One would be, which of these programs or policies really have the best chance of attracting kind of broad political support? And or like, what motivates you to keep fighting for those? Like, how do you, this is hard work. A lot of folks on this call are trying to figure out what piece of the puzzle will be theirs in their lifetime work, how they're going to contribute to this work as practitioners, as researchers, as policymakers. Kind of what is giving you hope for going forward with this work, and kind of what gives you hope personally to keep fighting for it?
Yeah, that's a great question. Personally, well, this is the second of two reports. The first one came out in 2019, and it was focused not on intergenerational poverty, but short-term poverty. What can we do that's going to reduce child poverty? And one of the big policies that we evaluated that had the biggest effect on reducing child poverty was an expansion of the child tax credit, which, the parameters that we had on our expansion were exactly what went into the congressional legislation, right? So the first time in my career that something is actually linked up, something I did to, some policy change. Maybe there are other more indirect kind of policies. You can't expect everything you do to be a winner, because to have successful policies, you get into the politics of it. A program evaluation only goes so far when people are debating politically about whether a program is good or not. So you can't think you're always going to do winners. What you try to do is your best work to evaluate whether policies make sense or not, to come up with ideas for policies and try them out so you can convince someone to maybe think about adopting it. It's extremely rewarding to try, even if you don't succeed, because there are so many things that can thwart you from succeeding, none of which have anything to do with the quality of the work that you're doing. Oh, and so which of these, the political climate is so dire now that it's hard to imagine Congress taking any action on almost any of these policies that we talked about, right? Stepping back, in more normal times, things like the Earned Income Tax Credit, that's a pretty popular bipartisan program. It's kind of like the child tax credit, except it has stronger work incentives. And there's something about the combination of transferring a lot of money coupled with the work incentives that are part of it that seem to benefit kids, right? So it's a bipartisan program. I think there's a decent chance that if there are reforms, it would be along those kind of lines rather than expanding the child tax credit. Other things, I don't know. You're catching me at a very bad time. In December, before the new administration and the new Congress took over, I would have been more optimistic. But these things happen in cycles, and it's not going to last more than 2 to 4 years, I predict. And who would have expected, when we wrote our report in 2019 with the child tax credit, there was no thought that there would be any inclination on the part of Congress to pass a big expansion of the child tax credit. And pandemic came along, and there it was. So don't try to predict the future. do the best work you can, and hope that you will make a difference. It's so important that you try.
Thank you so much for this and giving us your time and your expertise, and for doing the hard work of, I can't even imagine the consensus building, the work that it took to kind of take 14 individuals from very different places and get them to write a very long report that they could all sign their name to. We've all done a group project that is like the most
Yeah.
epic group project I could imagine. So
So
thank
if I could say, I do respond usually to email messages, maybe not right away. So if there are so many questions that as I look over the chat, I wish I had had time to answer. So feel free to communicate with me. If you Google Greg Duncan and don't select the bankrupt Amway salesman, that's me, University of California, Irvine, and send me an email.
And I'm going to work with some folks to figure out one of the best ways. There are some really good resources that exist that might answer some of these questions. And even if I'm going to try and find a way, maybe we can all see those questions and answers, because maybe you had the same question or someone else did. So I'm going to keep the chat. If you want to add questions, maybe I can find ways to kind of do that. And we can use our internal expertise as well to kind of help point out other resources for
Yeah,
continuing.
well, you can set up a Google Doc or something
Yeah.
like that has the questions and then a column for my answers.
Yeah. We all love a Google Doc and Shep. They're very familiar with Google Docs now. Well,
Good.
thank you so much for being here and your good work. All
My
right.
pleasure.
Thank you so much.
Good to see everybody.